Hi, my name is Deborah, and I've been the business administrator for All County Dermatology for the past 19 years. I'd like to introduce you to the practice and to Dr. Barry Weiner, a board-certified dermatologist who's the owner of the practice. Dr. Weiner is what I refer to as a family dermatologist, since he meets the medical, surgical, and cosmetic dermatology needs of the entire family, from infants to seniors. Here's Dr. Weiner to tell you a little bit more about the practice and himself.
Hi, I'm Dr. Weiner, and I'd like to tell you about my philosophy and approach to providing dermatologic care at All County Dermatology. I like to greet each patient and then make every effort to listen to and address my patients' concerns. It's extremely important to make patients feel comfortable in my office, especially when dealing with skin conditions that patients may be uncomfortable discussing or those that cause embarrassment. The goal is to help patients with their dermatologic problems, not to pass judgment upon them. The next step is to carefully examine the patient's skin problem and make an accurate diagnosis. Most of the time, a definitive diagnosis can be made based on the physical exam and the patient's history. There are also many instances in which a diagnostic procedure, such as a skin biopsy or blood work, is required to make a diagnosis. Once a diagnosis is made, I then explain the skin condition to the patient and discuss the various available treatment options. I also make a point of informing patients of the risks and benefits of each treatment option, and then help them to select a treatment that is most appropriate for them. It's also extremely important to provide a reasonable expectation of their treatment. When deciding upon treatments and medications, I always keep in mind the high cost of certain medications and base my decisions on which medications provide the best therapeutic results, in addition to what is economically feasible for each patient. My tendency is to prescribe generic medications whenever possible, unless a patient specifically requests the brand name product. While my practice provides many of the newest treatments in cosmetic dermatology, my staff and I do not attempt to oversell cosmetic products or procedures. We recommend that medically necessary skin conditions such as skin cancer, infections, psoriasis, eczema be addressed before focusing on cosmetic procedures. As a physician and a dermatologist, I feel that it is my responsibility to make a patient's health my number one priority. If a patient does have a need or interest in one of our cosmetic services, my staff and I will be happy to discuss it and provide detailed information on that service. At All County Dermatology, we strive to meet patient expectations and provide positive outcomes. Speaking of positive outcomes, another one of my core beliefs is to do what is best for the patient, even if that means referring them to another physician or specialist. I have often been told that I have excellent diagnostic, therapeutic, and surgical skills, and what I do very well. There are, however, certain skin conditions and situations in which a patient would be best served by referral to another physician with special expertise in diagnosing and treating that patient's condition. I prefer to only refer patients to physicians whom I trust, whom I would use, or whom I would refer my own family members. I feel that if patients are pleased with physicians I refer them to, it only strengthens the trust and patient-doctor bond I share with them. Although I do recommend referrals for certain physicians, patients are also free to choose their own physician specialists. If you are in need of dermatologic services, I hope you will consider All County Dermatology to meet those needs.